Well, hello and good day, good evening, good morning, wherever this finds you. My name is Andy Grider. I am the host and producer of Unique This Week. And man, I'll tell you, it is so much fun to do this show. We always have a blast because we get to bring you people that are doing something different, something unique, something blue ocean, something, dare we say, disruptive. And what we have today is Breck Rice. Breck is a healthcare disruptor in the highest regard. He is doing some really important work, both in the anti-PBM space and in keeping small business America afloat while helping fix the healthcare system in a very unique and interesting way. Really excited to have him here with us. Breck, thank you for taking the time today.
Oh, thanks, Andy. This is such a pleasure to be on with you.
Yeah, likewise. I mean, we haven't known each other that long, but I really, really jived with a lot of what you had to say. Our backgrounds have an awful lot of wacky synergies, and just found out one just a minute before this that has nothing to do with business. So, it's always fun to talk with people who have a good heart and have a lot of background in business, and you really have both. So, let's talk sort of. I mean, let's start with ServeRx and talk a little bit about that. And talk about how that came about and how remove the middleman is why that's so important.
Sure. No, I appreciate anytime I get the opportunity to talk about our program because it is very unique. Not everyone knows that a service like ours even exists. But I got started first in this same space, in the same industry over 20 years ago, 2003. I went to work for a pretty small little healthcare company out in Tennessee, based in Western Tennessee. And the company was providing third-party programs for community pharmacies. It had a really generic name called Third Party Solutions. And I went out to help grow that program. And what Third Party Solutions did was it helped independently owned pharmacies and then chains eventually help their patients when they walk into a pharmacy after they've been hurt on the job and get their prescription medications without any hassle or delays. And so it was a program to help those individual pharmacies provide a better service to their patients. Wonderful, wonderful program. Before Third Party Solutions, the alternative was the patient would come in. If the pharmacist knew them, they were their neighbor, they knew who they were, they might take the risk and go ahead and fill the script and send the patient home with the medications that were needed. But in most cases, they would make the patient either pay for the medication out of pocket, or they would say, hey, you can take the receipt back to your employer for reimbursement, or they would turn them away and send them to another pharmacy. And so TPS really came in and helped streamline that whole program so that those patients could get taken care of that same day without any hassles or delays. And so wonderful, wonderful program. It grew. I was a part of growing that. My role was the director over community pharmacy. So I got to work with all these buying groups and people that have these small regional chains. And then it developed into even providing the service for the large chains as well. We had one competitor in the space out of Salt Lake City, Utah. They had about a 25-30% market share. We had, the lion 70-75% market share. And eventually private equity got involved. And so that gave us the capital to go buy our competitor and just merge the two companies together. And then we had every chain, every independent, every regional chain in the country used us as that default processor.
Wow.
Well, a big PBM, a pharmacy benefit manager, saw this opportunity, right? Because we were taking all this first fill funnel into the company, and they could just see dollar signs. If we could redirect those claims into our networks, we'd make millions and millions of dollars. And so that's exactly what they did. They acquired the company. And I didn't want to go to work for the dark side. I built a career in helping community pharmacies actually get a fair reimbursement while taking care of those patients. And that's not the PBM way. The PBM way is contract with the pharmacy to take as little as they'll possibly take. So contract them down so that they can't even cover the acquisition cost of the drug so that they could pocket more of the revenue themselves. And so I didn't sign up for that. I left. And about 3 days after I left, I get a knock on my door, and there's a sheriff deputy. I go to the door, and this sheriff deputy actually had a packet of information for me. It was in a temporary restraining order, a TRO. I was basically a gag clause from this big entity now that was going to funnel all these claims into their network and make millions of dollars. So they wanted me to be quiet, not go tell pharmacy, hey, listen, you remember those $70, $80, $90 reimbursements you used to get from my company? Well, now they're going to be $4. Are you cool with that? So I had this gag order that I had to honor for a couple of years. But when that ran its course, we started the new and improved third-party solutions, which is called ServeRx. So same program, just with 20-year newer technology.
And so essentially, this is sort of the anti-PBM. You talk about remove the middleman, healthcare disruptor, things like that. And you're really only targeting the small pharmacies, but there's been a huge downturn in the amount of those out there, hasn't there, Breck?
There has been, yeah. We during the pandemic, during COVID, we actually got reports of more and more closures, and we get updates from all of the contracting arms of community pharmacy, their buying groups and PSAOs that do their third-party contracting. And we were getting weekly updates that there was another couple of closures here, another couple of closures there. And then Fortune magazine actually did an article on the industry and stated that in the first time in the history of America, we'd actually dipped below the 20,000 independent level. And the number one reason was the profit margin. So back when I first started in the industry, the profit margin for dispensing medication was fair. It was about 36% profit margin, something that the pharmacies could live on. Today, you have any idea what that profit margin might be?
I'm going to have an unfair advantage if I can remember what you told me, 4 or 5%.
Yeah, 3 to 5% today, which quite often doesn't even cover the acquisition cost of the drug. Not to mention, you still have your overhead of a pharmacy,
Sure.
Of the employees.
Yeah, so simply filling more prescriptions isn't going to help you either. You're still at a negative margin at that point.
Yeah. Then on top of that, there's this crazy thing called a direct indirect remuneration. It's a clawback that the PBM can claw back payments that they've already made. So they're already not paying you enough to cover the medication cost. And then whenever they feel like it, they just go claw back payments. And so pharmacies are just throwing their hands up and saying, okay, we're just going to close our doors, or they sell their files to the big chain and big chains. And one of those big chains owns one of the PBMs who's helping them go out of business so they can buy their files. Something wrong with that, right?
Yeah, I was going to say snake eating its tail in a not so nice way. Yeah. So you and I have talked about this a little bit. You came up with a way to help make that not even close to the only profit center for these, 19,000 some odd remaining small pharmacies. I was really impressed with what you came up with. I thought this is, something that makes a lot of sense. But let's before we jump into that, let me ask you the sort of setup question for this, Breck, is what effect did going under 20,000 pharmacies have on the American populace? What would our listeners appreciate about how bad that actually is? Because 20,000 still sounds like a big number if you're thinking about numbers, relatively speaking.
Yeah.
But let's talk about what that means.
Yeah, what that means is we are creating pharmacy deserts, meaning there are parts of the country now that don't have a pharmacy. So you literally will have to travel, 60 miles maybe to the next town over in order to get your prescription filled. So you've got to take maybe 2 hours out of your day just to go to the pharmacy. And And if it's not an independent pharmacy who can fill your script in 10 minutes, you may be waiting 3 or 4 or 5 hours if you've gone to one of the box stores.
Just had that happen. I had to wait 4.5 days. It wasn't hours. It was 4.5 days to get things filled.
Yep.
So yeah, it's and even I live in a not so rural area, but not big city either. But even here, there really aren't too many more mom and pops left. You've got box stores, and that's really about it. And I don't like using them, but it's what's here. Um, and so I think there's a lot of places it's been driven out. The good part is you and I both have ideas for how to help bring some of those back and help the ones that are there thrive. I'd love to get into what you've developed with Fountain of Youth. I mean, this is a really cool idea. It's brilliant for its simplicity and its complexity all at the same time. So why don't you talk a little bit about what spurred the idea for Fountain of Youth?
Sure, of course. So, after seeing some of these closures, being announced and getting those, updated reports from the PSAOs, the pharmacy service organizations, showing the list. Okay, this one's going to close in a week. This one's going to close in 2 weeks. I mean, I started thinking, we're not going to have a business any longer as ServRx if these people don't stay in business. If we can't help these independently owned community pharmacies actually not just survive, but how do we help them thrive in this current economy? So I put my consulting hat on, and I started, looking at different solutions out there that were non-dispensing revenue solutions. Then I got it looking at what pharmacies did survive and how they survived during the pandemic was that they got involved in helping out with the pandemic. They started doing testing. So they would do point of care testing. I was like, okay, that's ingenious. Start being a part of the solution instead of just saying, oh, there's a problem, we've got to close our doors. No, how do we get involved and be a part of the solution? So then vaccinations became available. Well, a lot of community pharmacies always did, your flu shots, right? Well, they just expanded upon providing additional vaccinations, and that really saved a lot of pharmacies with revenue by being a part of the solution, providing vaccinations. But they're doing it still from the pharmacy standpoint. So I started looking at what are the payers paying for that service. Well, when a community pharmacy gives a flu shot, the reimbursement is somewhere around $17, $20 to $20 in that range, just for a common flu shot. It doesn't matter who they're billing to, United Healthcare, Blue Cross Blue Shield, whoever the patient's provider is. That's who they're billing, and that's what the reimbursement was. But then I started to investigate and see, what does a clinic get reimbursed for that same flu shot? Well, the clinics are getting reimbursed over $80 for the same flu shot. So I'm sitting there going, well, that's not fair either. Pharmacies always treated like the redheaded stepchild. So how do we circumvent that? And so this whole idea of putting a wellness health hub right into the community pharmacy, credential that health hub into the commercial side, so the health insurance side, the same amount of work that they're doing, but now getting a more fair reimbursement. I have one client that did almost 10,000 flu shots last flu season. 10,000, that's a lot. Well, they have multiple stores, so it's not just one location. They got reimbursed $167,000 for all of that work. They do the same amount of work. Now credentialed, they'll make almost $1 million in reimbursement.
Yeah, it's a big difference there. I mean, I was going to say it's a big difference in what you're helping them do. But now I know you take this even further down the realm of that Fountain of Youth idea into life extension therapies and other things, other modalities, other methods. I'd say newer or less known type of things for them. Can we talk a little bit about how you're helping expand the range of services? I mean, again, nothing against flu shots, nothing against being reimbursed well for different types of shots. Those are all preventative, value-based medicine moves that are really smart. They're moving in the right direction. But what you're doing next actually takes us even a few steps further down the rabbit hole towards where Alice lives. So let's talk about that a little.
Well, we don't live in the 1900s anymore, and so technology is pretty important. And one of the greatest technological advances in pharmacology is PGX, or being able to do DNA testing to identify with that individual patient's genetic makeup what works for them. So, big pharma counts on patients, every patient needs their medication. And so they want everybody to be prescribed their particular medication. But if you look at the efficacy of even these blockbuster meds that are on the market, they may only have a 30% utilization. The patient, only 30% of the patients taking the medication are actually getting the intended benefit. So through pharmacogenomics, we can identify, okay, this medication doesn't work for you. Here's the list of medications that do. Or maybe it's the right medication, but it's not the right dosage because their metabolism is so much different than the clinical base that was the trial was done on. So we have the technology today to actually customize medication. I quite often get asked, well, here, aren't you in a pharmacy? Don't you want to dispense? No, go back to the original, the earlier discussion. Doesn't matter how many new patients you bring in if you're only getting reimbursed, $4 for a script that costs you, $6 or $7. You can double your patients. You're just going to keep going in the hole. So
that's a losing equation. I don't care how bad you are at math.
Yeah, exactly. So to be able to help patients get off the medication hamster wheel, actually get them off medications that are doing more harm than good. And people are amazed by that. But you're in a pharmacy. Yeah, we're in a pharmacy, but we're taking people, we're deprescribing more than we're prescribing in this scenario. Why? Because of all the health benefits by looking at some of the other other things that could be used to offset. So we do a lot with pain management, right? With workers' comp. Number one, drug therapy in work comp injury is a pain med. Okay, pain, inflammation, and then some antibiotics because of cuts and open wounds like that. There is non-invasive ways to get pain relief. Right. I got exposed to PEMF, pulsating electromagnetic energy.
There's a personal story there around those bioelectronics. I wanted to make sure we get to that.
Yeah. About 6 years ago, my niece had gone through. She had a brain tumor. She went to St. Jude. They cured her of the cancer, but she had taken the maximum amount of radiation that her little body could take for her life, right? So that, even though they cured the cancer, she had all of that scar tissue, and it made it really hard for her to breathe without the aid of oxygen. Wow. Yeah. So here she is, cured of cancer, but still now needing oxygen. And we hear about this doctor up in Scottsdale, Arizona, that had developed with some PhD nuclear science guy his own PEMF. And we said, we better check this out. And sure enough, it worked. My niece called it her magic box. They gave her a prototype to take back to Nevada. They're from eastern Nevada over by Lake Tahoe, or western Nevada on the other side. And they gave her a box that she could take back and again, hadn't gone through FDA approval or anything like that, but the technology worked. Well, now fast forward, 6 years, and I get doing some research, and I find this medical device that has gone through the whole FDA approval process. It's not only, FDA NGX class 2 approved, it's being used all over Europe in hospital systems. Even poor countries like Hungary put this technology into their hospitals, into their babies' incubators, because it helps the baby's lungs develop faster, and it helps circulation, improve circulation at the micro level. I mean, not your big vessels, but the capillaries, which is where over 70% of your circulation happens. Well, if you have better nutrients and vitamins and oxygen going to your cells, you're going to have less inflammation. So what causes diseases? Well, inflammation. So it's reducing inflammation, increasing circulation. Got pretty excited about this. It's manufactured out of Germany, and they, like I said, it's gone through that. In fact, they did a independent study with NASA. They're putting this technology into the astronaut spacesuits because if you stay in zero gravity too long, you get sick.
So
You need that.
suddenly, Breck, this is rocket science.
Yeah, exactly. You need that magnetic pole, and so this technology gives you a really low magnetic pole, and
Wow.
incredible.
Wow.
Professional athletes have been using it for years. All of the the NFL. In fact, the NFL retired players or their alumni association endorses the technology. Beasley Reese is a spokesperson. He's an ex-NFLer, and a lot of tennis players, golfers that use this. Over 2,000 pro athletes that use this technology. We're now with that class 2, certification or approval. We can now bring that technology to the masses. You don't have to be rich and famous to afford this.
Wow.
You can go to a Fountain of Youth and therapy and have a session, because Medicare will pay for it, and the insurance will pay for it now.
That's, I love seeing technology and progression get leveraged properly. There's so many times at the beginning of your story where the greater good was not met by what was available. And now you've turned it back around. And so, Breck, I know there's contact information on the screen here for somebody to be able to scan the QR code. What's the best way for somebody to get hold of you if they wanted to reach out by email or phone or something like that, or text? And then secondly, the other part beyond that is, who is it that you want to have reach out to you? Outside of the small pharmacy owners, who else is a good person for you to talk to? Let's let our
Yeah. So I thank you for asking that question, because this little, project to not only help community pharmacies thrive, bring in new revenue sources, but also be a better solution for their community, be that health hub again for their own community. And the ultimate goal here is to bring wellness centers to be able to support 98% of the nation in 10 miles or less. That's what we have the ability to do here. So it has started to take this life of its own. And so my ask, what I'm looking for a co-founder. I'm looking for somebody who can come in and run the Fountain of Youth full time, and help with that build out, because it is taking a life of its own. You can easily scan my QR code up here, because that'll take you to my LinkedIn. By having a unique name like Breck Rice, I am the only Breck Rice on social media, so it's pretty easy to find me on LinkedIn. But my email is just simply my first name, BRECK, at serve, that's SERV, no E on the end, just serverx.com.
Awesome. Breck, I can't begin to tell you how exciting it is to get to interview entrepreneurs all the time who have incredible blue ocean ideas. It's not like we don't talk to a lot of people that are really cool and on cutting edge, but there's so many pieces. This hits on so many levels, heart level, head level, pocket level. I mean, bottom line level. This is really brilliant stuff that you've got going on, and wish you luck and very, very good success. I want to have further talks with you. And again, thank you for being a guest here. Really appreciate it.
Yeah, thank you, Andy.
So my name's Andy Grider. Again, I am the host and producer for Unique this week, but we're never anything without our guests. And we just had a great guest in Breck Rice, who is doing amazing things, both for the small pharma, for the folks who are out in, as he called it, the desert pharmacy deserts. They've got 60 miles to drive. There's ways to reopen those pharmacies, folks. There's ways to get this out back into the area that it needs to be. There's ways to help companies that are self-funded with what he's doing on the ServeRx side, also, as well as what he's doing on the health side. There's a lot of different potential modalities here. I can see things with urgent care centers. I can see things with other groups. There's all sorts of things we can do. So if you know somebody, first of all, who's looking for a position where they could be the head of the foundation, please share this interview with them. If you know somebody who runs a small pharmacy that doesn't already know Breck, introduce them, send them this. If you know somebody who is entrepreneurial and wants to get involved and wants to do some good things, send this to them. Enjoy the interview. Breck's full of great ideas. I love the way his brain works when he puts on that consulting cap. Again, we'll be back very soon with another episode. If you know somebody who'd make a great guest, somebody who's doing something blue ocean, something new, something that inspires you, something that gives you new ideas, please reach out. Let us know. In the meantime, have a great day. I know we're coming up on Turkey Day, and this is going to date the show a little bit, but happy Turkey Day early, and we'll talk to you all soon. Thank you.